Bon après-midi. Thank you for joining us for today's media availability on the novel coronavirus COVID-19. Merci de vous joindre à nous pour cette disponibilité média au sujet du nouveau coronavirus COVID-19. A reminder, if everyone could please go on mute, that would be much appreciated. We ask that you can just release the mute when you're speaking to ask your question. To view the city official who is speaking on Zoom, please put your view on speaker view instead of gallery view. The button for this is located in the top right corner of the Zoom video screen. Veuillez changer votre écran au mode speaker en anglais pour pouvoir mieux voir les porte-paroles. Le bouton est situé en haut à la droite de la portion vidéo de l'écran. Reporters with accessibility needs can pin the interpreters or follow on the YouTube stream. Les journalistes ayant des besoins en matière d'accessibilité peuvent avoir recours aux interprètes ou suivre la diffusion en direct sur YouTube. Today we will be hearing from Dr. Vera Etches, Chief Medical Officer of Health, Médecin-Chef en Santé Publique, and Dr. Andrew Wilmore, Champlain Health Region Incident Commander, Chef des Interventions d'Urgence en Santé de Champlain. After we hear from Dr. Etches and Dr. Wilmore, we will take questions from the media. Please note that we will be going by reverse alphabetical order by media outlet, so please be ready with your questions. Each outlet may ask one question and one follow-up. At this time, I invite Dr. Etches to say a few words.
Testing criteria. Did everyone hear me from the beginning? I just want to check. Yes? Okay. I just got a message about being unmuted. So yesterday I spoke about the new testing criteria. In addition to now allowing testing of some asymptomatic residents and staff in long-term care and retirement homes who are experiencing an outbreak, the province added a list of less common COVID-19 symptoms to the testing criteria, like nausea or vomiting, diarrhea. Especially that's for older populations or younger populations who may have atypical presentations. And the province also, are we having trouble? I'm just getting a message that, shall I continue?
Vera, if you could just start from the top, I think that would be great, please.
Okay.
Thank you.
Yesterday, I spoke about new testing criteria. In addition to now allowing testing of some asymptomatic residents and staff in long-term care and retirement homes experiencing an outbreak, the province added a list of less common COVID-19 symptoms to the testing criteria, especially for older adults and younger children who may have atypical symptoms like nausea or vomiting or diarrhea. And the province again last night increased the categories of people eligible for testing. Hier, j'ai parlé de nouveaux critères de dépistage, en plus de permettre le dépistage de certains résidents et du personnel asymptomatique des maisons de retraite et les foyers de soins de longue durée en cas d'épidémie. La province a également augmenté les catégories de personnes éligibles au dépistage et ajouté une liste de symptômes moins courants aux critères de dépistage. So these expanded criteria will allow us to test more people and get a better sense of the potential scope of infection in our community. And this is important into the future as we continue to look for more targeted strategies and the eventual relaxation of restrictions. The new categories of people eligible for testing, if they're experiencing at least one symptom, include people and workers in congregate settings like group homes or hospice environments. First responders, caregivers, people with frequent healthcare contact, and people living in remote or isolated rural or Indigenous communities. So I encourage people to visit ottawapublichealth.ca/coronavirus for all the details about the new testing criteria and to go get tested if it applies to them. We're starting to see the numbers increase again at the assessment center. J'encourage tout le monde à visiter notre site web pour obtenir tous les détails sur ces nouveaux critères et à aller se faire tester si cela s'applique à eux. We know the situation is taking a toll on people's mental health. This was a common concern shared with me on Twitter this morning when I asked for residents' ideas about how we can continue to sustain physical distancing measures a bit longer. And everyone will experience this situation in their own way. As it is completely natural to feel stress and concern during these times, and so it is important to practice positive coping strategies. Just to note that drinking alcohol is not a positive coping strategy, but our team has added various resources on the Ottawa Public Health website, including a video on maintaining your mental health and a list of telephone, text, or chat services. These may be helpful to you, but if you are in a real crisis, please contact the Distress Center at 613-238-3311. They are available 24 hours a day, 7 days a week. Nous savons que cette situation a des conséquences sur la santé mentale des gens. Chacun va vivre la situation à sa manière et il est tout à fait naturel de se ressentir stressé et d'être inquiet. Il est donc important de pratiquer des stratégies positives d'adaptation. Notre équipe a ajouté diverses ressources sur le site web de Santé publique Ottawa, notamment une vidéo sur le maintien de votre santé mentale et une liste de services téléphoniques, texto ou de clavardage. Ces ressources peuvent vous être utiles et toutefois, si vous êtes en situation en crise, veuillez contacter le centre de détresse au 613-238-3311. Ils sont disponibles 24 heures par jour, 7 jours par semaine. Also, in response to the COVID-19 situation, the walk-in counseling clinic is now offering phone and video counseling services. So again, you can visit their website at walkincounseling.com for more information. And another thing that came up is a lot of people have been continuing to ask if they should be wearing face coverings or masks when they leave their home and go out into the community. This was a common theme on the Twitter discussion about how we can continue physical distancing, and I think that's appropriate. We know as we go out into the community that there are asymptomatic and pre-symptomatic transmission of COVID-19 is possible. And so if you can't maintain that physical distancing, wearing a mask helps protect people that you might come into contact with when you're out in the community. It provides that added layer of protection. So we continue to ask people to limit their trips outside the home to essential needs like groceries or medicine or physical activity, and to limit close contacts to members of their household as much as possible. So thank you to the many people on Twitter who's given us ideas about how we can be resilient in this difficult time. The top themes shared were about how we can consider to use our outdoor spaces in the best way possible, and for us to continue to spread love and kindness in different ways. So I'll take these suggestions into the planning process for when we are able to safely relax restrictions. Our efforts are working. We are seeing signs of hope, but we need to keep practicing physical distancing in order to get to the other side of the curve. I've received feedback that you don't need me to go into detail about all the numbers, but I am happy to answer questions about them. And so lastly, I want to thank the media for working diligently to keep residents informed. Enfin, je tiens à remercier à nouveau les médias pour travailler avec diligence afin de tenir les résidents informés de la situation de la COVID-19 à Ottawa. Merci.
Thank you, Dr. Etches. At this time, I invite Dr. Wilmore to say a few words.
Thank you. The province of Ontario is taking important steps to protect some of the most vulnerable residents in our community, namely the elderly and those with medical needs who live in long-term care facilities in Ontario. The safety of those most vulnerable to COVID-19 is of utmost importance, and hospitals in the region are in compliance with this new directive and are in the process of actioning the various recommendations. Given the rapidly evolving nature of the pandemic and response, Champlain Health Region Incident Command will be operationalizing the directive in the coming days, and we will be addressing the nuances of this rollout. La province de l'Ontario prend des mesures importantes pour protéger les membres de la collectivité parmi les plus vulnérables. nos aînés et les autres personnes qui habitent dans un établissement de soins de longue durée. La sécurité des personnels les plus menacés par le COVID-19 est primordiale. Les hôpitaux de la région soutiennent la nouvelle directive provinciale et travaillent déjà à mettre en œuvre les différentes recommandations. Étant donné l'évolution rapide de notre réponse de la pandémie, le commandement des interventions d'urgence de la région sanitaire de Champlain étudiera pendant les prochains jours les détails de nouvelles directives afin d'en saisir les nuances. We are working together as a region to build capacity across the system for patients. Last week, we put processes in place to streamline transfers of COVID-19 positive patients requiring acute or critical care from smaller hospitals in the region to a select number of larger hospitals. This ensures that patients whose care needs cannot be met at the smaller local hospitals will be removed to a higher level of care in a coordinated manner that does not lead to overcrowding. And this balances the capacity across our care centers. This process is running smoothly and has been used to facilitate a number of transfers. In addition, we're beginning to transfer patients with alternate level of care to regional hospitals to provide care in a setting that matches their needs. Nous travaillons ensemble en tant que région afin de renforcer les capacités du système de santé. La semaine dernière, nous avons uniformisé et centralisé le processus pour transférer les patients atteints de la COVID-19 vers des hôpitaux aptes à leur fournir les soins actifs et critiques. Ainsi, les patients dont les besoins dépassent les capacités d'un petit hôpital seront transférés vers les plus grands hôpitaux d'une façon coordonnée qui ne cause pas de surcharge. Le processus fonctionne bien. Nous commençons aussi à transférer des patients ayant besoin de niveaux de soins alternatifs vers les hôpitaux communautaires afin de mieux répondre à leurs besoins. By applying this regional approach to patient flow, we'll be able to ensure that we're continuing to provide the best possible care for our most vulnerable patients. Grâce à cette stratégie régionale de gestion du cheminement des patients, nous pourrons continuer de veiller la qualité de soins aux personnes les plus vulnérables. The COVID-19 care clinics in the East and West Ends continue to provide treatment for individuals who are experiencing mild to moderate symptoms of respiratory illness requiring a medical assessment, such as coughs, fever, and other cold-like symptoms. The clinic in the West End is operated by the Queens Carleton Hospital, while the clinic in the East End is operated by Hôpital Montfort, both with the help of community primary care physicians and pediatricians. To date, the clinics have provided care for nearly 500 patients. I also have an update on the COVID-19 Assessment Center at the Brewer Arena. The Assessment Center has a new operating hours and will now be open from 9 a.m. to 3:30 p.m. 7 days a week. And over the last month, the Assessment Center has tracked when patients are arriving for care, and the changes to the hour reflect the needs of this assessment. The care team has also been very successful in streamlining the processes, allowing us to test more patients per hour than when we started. Today's another busy day at the Brewer Assessment Center, and we are grateful to the media for spreading the word on the new testing criteria. Thank you.
Thank you, Dr. Wilmore. In the interest of time, I will quickly read through the list of media who have registered. No need to indicate if you are present. However, if I missed your outlet, please speak up after I am through the list. Pour gagner du temps, je vais lire la liste des médias qui se sont inscrits. Vous n'avez pas besoin d'indiquer si vous êtes présent, sauf si je n'ai pas nommé votre organisation. Your Community Voice, TVA, Rogers, Radio-Canada, Ottawa Sun, Ottawa Citizen, Global News, Le Droit, CTV News, CBC News Ottawa, 1310, 104.7 Outaouais. I will now invite each agency in reverse alphabetical order to ask their question. Please remember you have one question and one follow-up. Nous allons maintenant répondre aux questions des médias en ordre alphabétique inversé. Chacun pourra poser une question et une question de suivi. We'll now start with Your Community Voice.
Yeah, I'm not sure if my question's for Dr. Etches or Dr. Wilmore, but I'll ask it. You spoke a lot today about people with mental health issues through this pandemic. There are a lot of online resources, but do you know if there's been a spike of people showing up in emergency rooms, say at CHEO or the Ottawa Hospital, Queens Carleton, over the past month with mental health issues?
I'll take that first, unless Dr. Wilmore wants to jump in. Oh, I see I'm supposed to use my video, sorry. So the emergency room visits are actually down quite a lot. So they're at about half of their usual volume, which is why we do want your help to get the message out there that if people are in a crisis, those services are there for them. The emergency room definitely are a place to go if there's a mental health crisis. As well as people can phone the distress center, which will help people navigate where's the best place to get help. And so I think the other thing is these new tools, how much they're being used is something we're looking to add into our surveillance system. So as we're looking at the number of lab cases, is part of the other picture is what's happening in our community. So we're working with partners to get a handle on that as well in terms of how these services are being used.
Thank you, Doctor. Patrick, do you have a follow-up?
Yeah, I do. On a different subject, I just wanted some clarification, from some of the comments yesterday around personal PSWs. The ones that come into private homes, I mean, by the nature of that job, they go from home to home throughout an 8-hour day. What are the rules around that? I mean, in the long-term care centers, they're only supposed to be working in one now. So I'm wondering how those PSWs that go from home to home over the course of a day, how are they being tracked?
I'll go first again, and I'll pass it over to Dr. Wilmore as it's a healthcare issue, but I made the comments yesterday that as much as possible, it's good to limit the contacts that people have. And so, working towards a situation where one patient or client has the same personal support worker rather than multiple different support workers is ideal. That's what we'd be aiming for as much as possible. You're right, it is the nature of the work to go to more than one client in a day. And so that is why they're instructed about personal protection and how to do that safely.
I'll chime in as well. So we do have a regional HR committee that's actually looking at a lot of these different factors in terms of, what does as we aim to limit the contact throughout different institutions and different homes, what does the deployment model look like for these PSWs that are doing very important work? People are dependent on their care. So we will continue to work with public health and follow ministry guidelines in terms of operationalizing this to make sure that we both protect our patients and also maintain continuity of operations.
Thank you. Next up is TVA. TVA, Quinze, es-tu prêt?
Allô, est-ce que vous m'entendez?
Oui.
Super. Donc, moi, c'est concernant les données d'aujourd'hui. Donc, on parle de 15 éclosions dans des établissements en ce moment à Ottawa. Hier, nous étions à 16. Je voulais juste savoir, là, il y a, j'imagine, un établissement qui a été résolu. C'est lequel? Est-ce qu'on peut avoir un peu d'informations à ce sujet-là?
Dr. Etches or Dr. Wilbur, would you like the question repeated?
J'ai essayé de répondre, mais je n'ai pas le micro ouvert, je m'excuse. Non, c'est vrai qu'il y a des éclosions qui sont résolues. C'est bonne nouvelle, c'est possible. On peut arriver à la fin d'une éclosion. Je vais juste vérifier le nom de les maisons où c'est résolu, mais je n'ai pas cette information maintenant parce que j'ai juste la liste des éclosions au courant. Alors, je vais demander à mon équipe de faire le suivi pour donner les noms à vous pour les éclosions résolues.
Parfait. Quinze, une suivi?
Oui, moi, c'est concernant aussi les masques. Vous avez parlé un peu de ça, Dr. Etches, un peu plus tôt. Je voulais juste savoir en français, là, c'est ça, il y a des résidents qui se posent la question, qui se disent, est-ce que je devrais, quand je sors de la maison, là, porter des masques, ce que vous aviez dit en fait un peu plus tôt, mais en français, s'il vous plaît.
Oui, beaucoup de gens nous demandent si on recommande qu'ils portent des masques lorsqu'ils quittent leur domicile. Nous savons qu'il existe une transmission asymptomatique ou présymptomatique de COVID-19. Donc, si vous ne pouvez pas maintenir une distance physique, le port d'un masque aide à protéger les personnes avec lesquelles vous pouvez entrer en contact. C'est un autre niveau de protection et c'est une bonne idée.
Parfait, merci. So next we have Rogers. Gavin, do you have a question? All right, we will go to Radio Canada.
Excuse me, j'ai les noms où les éclosions sont résolues. C'est le Montfort Hôpital, c'est aussi Park Place, et c'est Settlers Ridge, et aussi l'hôpital d'Ottawa, le Civic. Alors,
Depuis hier, c'est laquelle qui est résolue depuis hier?
C'est une autre question. J'ai le nom de les quatre. Je ne sais pas exactement quel hier. Je peux demander encore. OK.
Parfait, merci. Alors, Radio-Canada?
Oui, vous m'entendez bien?
Oui. Je m'excuse. Pascal? T'es sur mute? Pascal, on ne peut pas t'entendre. Pascal, est-ce que tu peux recommencer, s'il vous plaît?
Est-ce que vous m'entendez maintenant?
All right, so we will add Radio-Canada to the end. Radio-Canada, on va te retourner. Next up, we have the Ottawa Sun, Taylor Blewett.
Hi. So I know obviously we're not there yet. We won't be there for a while yet. But when we do get to a point when it'll be possible to ease up some of the restrictions right now, do we have a sense for like what that could look like? It's something we're hearing a lot of people ask and talk about. And can you give us a sense for kind of what types of discussions you're having right now about this, if you're consulting different groups in the city on this, and what the priorities kind of might look like right now as far as what would be loosened first?
Thank you. The discussions I'm having are with the city and with our healthcare partners to look at across all of those sectors, what do we need to have in place to feel secure that we'll be able to handle a relaxation of the restrictions. And then we're also just starting to think about what would be the priorities. We haven't got a list of priority places yet, and that's partly, I think, is important to have the perspective of the community on that. And so I'm going to be doing more consultation with the community about their thoughts. I think, the piece that's been discussed first is some of those very time-sensitive surgeries or healthcare that has been put on hold, and whether we can move ahead in a safe way once we know that hospitals are going to be able to maintain their capacity and they have the supplies they need. To be looking at some of those pressing things. We know that this is also going to be a provincial discussion, and so we're keeping in touch with the province, looking to better understand what work they are doing, and in connection with the federal government, because certainly when you start to ease up restrictions in one area, it'll have an impact on others, and we need to do this in a coordinated way. But I guess in terms of what I know is very likely to emerge is that it will be an easing up on the restrictions, that we wouldn't say, okay, everybody, go do whatever you want now, it's okay. I think we're going to be cautious, right? So we can monitor the impact of changes over time and make sure that we're not leading to a rate of infection that we can't manage. So that means that we would probably be asking people, if you're going back to activities, to still think about that physical distancing. How can you do those activities in a way that maintains that 2 meters distance from others, or use a mask if you can't? And so these are things that I will continue look for ways to engage the public in online consultations through other parties, and we'll certainly continue to share with you any plans that are evolving.
Thanks so much. And just as a follow-up, I'm wondering about a situation where a staff member at an essential workplace is suspected to have COVID-19. They go for testing. Should their close contacts in the workplace also be self-isolating until those test results come back? I've heard of a couple of situations where those contacts, will stay at work until they know for sure that there's a confirmed case in the workplace. What advice would you give employers on that?
That's a good question. I think that it will depend on the situation, the specific risk associated with that person's symptoms and their exposure. So our public health staff will advise on a case-by-case basis if needed when someone goes for testing because they think they might have COVID-19, is at a high risk to others in the workplace, for instance. If it's very high risk, then I believe we have been asking people to self-isolate, the contacts to self-isolate as a precaution, so that if they were to develop symptoms or they might be incubating in that period 2 days before showing symptoms as potentially people are infectious, that's a precaution. That said, that the time to turn around the lab test is very good right now. So the labs are turning a test around within a 24 hours that they receive it. And so it's not a long wait. And it may be that in cases with lower risk, people can wait for the result because there's a good chance it'll be negative, not COVID. There are a lot of other respiratory viruses in our community. And so, I think if there's questions about a specific case, please don't hesitate to call public health.
Great. Thank you, Doctor, and thank you, Taylor. We have received Radio-Canada's message in the chat, so I will read it first in French, and then if you'd like me to translate it for English, I can do that as well. Alors, Radio-Canada, on va demander ton question maintenant. Alors, j'aimerais avoir des informations sur le nouveau décès survenu depuis hier. Quel âge? Dans une résidence pour personnes âgées?
Il n'y a pas un nouveau décès aujourd'hui depuis hier. Alors, il n'y a pas un nouveau décès.
Parfait. Alors, la deuxième question, c'est au début du mois, la santé publique prévoyait une pic vers cette période-ci. Quelles sont maintenant vos prévisions? Elles ont changé.
Maintenant, nous sommes une bonne résultat concernant les hospitalisations. Le nom des hospitalisations presque stable, ça augmente un peu, mais pas beaucoup. Alors ça, c'est bon. Aussi, on peut suivre les modèles et on donne l'impression que nous sommes vraiment stables et on peut voir une diminution dans les cas des hospitalisations pendant les semaines prochaines. Alors ça, c'est les résultats que je voudrais suivre. Je ne sais pas si ça est une bonne réponse pour votre question.
Radio-Canada? OK. On va passer à Ottawa Citizen. Ottawa Citizen, Aidan?
Yes, hello. Thank you very much for the time and taking the question. It's regarding long-term care homes, obviously a very vulnerable population. We've also heard, obviously, that vulnerability extends to staff as well, a number of staff being infected in several homes. And the Ontario Health Coalition had been warning of sort of staff shortages even before this crisis hit. So I'm wondering if Ottawa Public Health has any sort of contingency plan to either assist long-term care homes in the event that staff members become sick and there is an even more critical shortage at a local home, or if there is any sort of contingency plan as far as the supply of PPE and masks if an outbreak hits and they find themselves short-staffed, short-staffed and short of equipment, if there's any contingency plan on either of those fronts.
I'm going to pass this question to Dr. Wilmore because the healthcare sector is providing support to long-term care homes in terms of staffing and personal protective equipment.
Thanks, Vera. So as Dr. Edson mentioned, we are indeed looking after long-term care facilities as well as retirement homes. And we are working closely with long-term care to make sure that the infection prevention and control procedures, and this is in collaboration with public health, are aligned throughout the institutions. We're reviewing policies and procedures, we're reviewing operational factors, and we will continue to support them. From a staffing perspective, we are currently building a regional human resources model by which we can backfill institutions that have had significant effects from the need for self-isolation for symptomatic healthcare workers or people who have swab positive. And we also have a regional logistical supply chain model to backfill any PPE shortages in the region. We're using both materials that we receive from the ministry as well as the donations that come to the regional table to be able to redistribute it in an equitable way. And that strategy will continue to include long-term care and retirement homes.
And just by way of a follow-up, if I could just ask either one of Dr. Etches or Dr. Wilmore just to speak about what this crisis really demonstrates as far as the vulnerability of long-term care homes, and if there is anything that we can take forward from this into the future to prevent similar crisis from happening.
I think any strain on a system will uncover challenges that need to be addressed, and that is exactly what we're doing. Again, by pulling the oversight and the coordination to a regional level, we have a real opportunity to make sure that we have consistent standards across the region, irrespective of what institution you're in, be it long-term care or acute care. The infection prevention and control procedures should be the same, and we are working with our partners in long-term care, retirement homes, and acute care to make sure that we have that consistency, because the primary prevention, the prevention of having these vulnerable populations get COVID in the first place, is of paramount importance. That's from physical distancing to appropriate use of PPE to ensuring that healthcare workers are self-monitoring and ensuring that we're very quick to react to any kind of outbreak. All of these things together will decrease the chance of folks in these institutions who disproportionately get the sickest from getting the disease in the first place.
Thank you, Doctor. Thank you, Auto Citizen. Global News, please go ahead.
Hi, just wondering if we have a sense yet if there will be an extension to the ban on major events and festivals in Ottawa past the June 30th date we have now, and any sense of how long that extension might be.
Thank you. I'm not the decision maker on that, so I think it's premature for me to weigh in. I think that as you saw when we were heading into the situation of requiring more physical distancing, there was guidance from the Public Health Agency of Canada about events, and it was a risk assessment tool. It's probably still on their website. And it gave some guidance around higher risk events versus lower risk events. I think that guidance is still relevant when we're talking about starting things up again. So I would look to that, and as things become clearer, if there's more decisions and a path forward on those kinds of things, I'll let you know.
Just a quick follow-up, if I can. Do we have any sense of any precautions that might be put in place if we even gradually start to see events come back, like a public gathering in a park, any kind of concert, as small as it could be? Could we see limits on crowd sizes, for example? Anything like that you can provide?
I think if we were to follow the principles that smaller gatherings are safer than larger gatherings, that would lead to some suggestions of how to start up again. Um, all the things that we're saying now about keeping your distance are relevant. They will continue to be protective if you can stay 2 meters away from others and wash your hands. These are still measures that will be relevant even as restrictions are raised.
Thank you.
Thank you both. Now for le droit, Julienne Paquet.
Oui, bonjour, Dr. Etches. Je voulais juste clarifier quelque chose que vous avez dit, mes collègues de Radio-Canada. Vous avez dit qu'il n'y avait pas de nouveaux décès depuis hier. Parce que
Oui,
c'est ce qui se trouve dans notre, ce qu'on a dans la mise à jour d'aujourd'hui, c'est qu'il y a on a un 14e décès, si je ne me trompe pas.
Ah oui, c'est vrai. Je m'excuse.
D'accord, il n'y a pas de problème.
Quelquefois, j'ai information qui n'est pas exactement au courant. Oui, on dit ici, je peux voir maintenant un nouveau cas depuis hier. Et je pense que Radio-Canada a demandé si c'était quelqu'un dans une résidence, oui ou non. Et je pense que c'est oui. Il y a 6 décès relayés ou une éclosion dans une institution.
OK. Donc, vous avez parlé plutôt des critères. Bon, vous avez parlé à plusieurs reprises, en fait, du fait que, bon, le nombre de cas confirmés, c'est peut-être pas la mesure la plus précise pour évaluer où on en est dans la courbe. C'est plutôt les hospitalisations et les décès. Le fait qu'on en ait eu dans 3 journées consécutives des décès confirmés, est-ce que c'est un signe qu'on est dans le pic ou il faut s'attendre encore à ce que ça augmente?
Euh, J'imagine ça va continuer à augmenter le nombre des décès parce que c'est un résultat qui suit les infections. Alors, ça prend temps après les infections d'avoir une sérieuse infection et un mauvais résultat comme ça. Alors, oui, j'imagine le nombre de décès va continuer à augmenter aussi parce que nous avons des éclosions dans des populations vulnérables. Alors, j'espère les mesures en place dans les maisons peuvent protéger les populations, mais c'est possible que c'est une norme qui va augmenter un peu plus aussi.
Ma sous-question, ce serait probablement pour le Dr. Wilmore.
Julien, je m'excuse. OK, on va laisser faire parce que le premier, c'était une clarification de Radio-Canada. Alors, continue, je m'excuse.
Oui, c'est bon. Je voulais seulement vérifier avec vous. Le gouvernement de l'Ontario a annoncé qu'il voulait augmenter significativement le nombre de lits disponibles un peu partout en province. À Ottawa, est-ce qu'on a une idée de quelle façon ça va s'opérer finalement? Est-ce qu'on a déjà un endroit en tête pour installer ces nouveaux lits-là?
Je m'excuse, je n'ai pas compris la question.
Le gouvernement de l'Ontario a annoncé plus tôt aujourd'hui qu'il voulait augmenter le nombre de lits disponibles dans les hôpitaux de la province. Est-ce qu'on a déjà une idée de la façon que ça va s'opérationnaliser à Ottawa?
Oui, donc nous avons déjà augmenté le numéro de lits, pas seulement pour... on a changé la manière de laquelle on distribue les patients pour toute la région. Donc, la planification de cette plan, c'est pour... on utilise les lits qui existent dans les facilités. Nous sommes aussi en train de construire à des autres environs pour les patients que nous ne pouvons pas envoyer chez eux parce qu'ils ont un test positif ou ils sont ou ils ont un statut de COVID que ce n'est pas connu. Donc, c'est très important d'avoir une facilité transitoire pour pouvoir discharge les patients jusqu'à cette facilité pendant que nous savons le statut de cette patient. I'll repeat it in English as well. I apologize for my French there. I'm learning a lot. So our regional surge model includes both outpatient settings as well as inpatient settings. So we've increased the functional number of beds within the institutions by changing the way that we house patients, and we have an escalating protocol where we can actually increase the number of patients in existing institutions. We've also required, based on our planning and projections, the build of transitional units to essentially allow us to discharge patients who no longer require hospital level care, but whose status in terms of COVID positive, negative, or unknown might limit their ability to go back to those institutions. So these transitional areas are really important to make sure that we have somewhere safe for these patients to go, pending their repatriation back to the centers from where they came to us from.
Great, thank you, Doctor. Thank you, Julian. CTV News, you're next.
Thank you very much. My question is just picking up on what Dr. Etches said earlier about a drop in ER visits across the city. Do you know why there's been such a drop in ER patients, and what's your message to people who may have normally gone to a hospital but maybe are afraid to go now because of COVID-19?
I'll take this question just because it's about the hospital sector. So our ER visits have been a lot lower through multiple mechanisms. So it was by design. So the care clinics that we opened on the east and west ends, the Brewer Arena Assessment Center that took the swabbing load off of local emergency departments greatly decreased the numbers of patients presenting. When you factor this into the fact that we have downregulated certain activities in the hospital, the visits for what happens to folks after procedures and such, where they require a touch point in the emerge, that volume has also gone down. We certainly have heard loud and clear that folks are nervous about coming to hospital, and I think it's important for the public to understand that our emergency department occupancies are low, and the reason that they're low is because we want to make sure that we can continue that care provision for patients. So it's really important for patients who are experiencing symptoms that pre-COVID would have brought them to the emergency department. Those patients should still come to the emergency department because it's more than just COVID. Folks have medical comorbidities that do require care, and if they're getting worse at home, we want to make sure that the public feels confident that the hospital is a safe place to come. We have the capacity. We've put in the mitigation strategies to make sure that we're not in an overcrowded state, and we want to see those folks in hospital.
And just my follow-up for Dr. Etches, a week ago you told council that there was between 11,000 and 34,000 COVID-19 cases in the city, just based on modeling. Any idea if there's been a major change in terms of where that would stand right now, a week later, as you increase testing capacity and people continue to practice physical distancing?
I look forward to providing an update on the modeling. That estimate was based actually on deaths. So it's looking at it, given the number of deaths we have, working backwards, because most people aren't going to get that terrible outcome. How many infections do you think we could see in the community? So we continue to use that work looking backwards. The more deaths as we go along, the more precise that estimate can become because we have more data. And so the last time I looked at it, I don't think the range had changed very much, given the way the model works. So But I will be able to provide an update on modeling again if that's of interest. I can look into that.
I would appreciate it if you could. That'd be great. But don't. I know you're busy, so there's other things more pressing. Thank you.
Great, thank you. CBC is next.
Yes, hi. This is picking up a little bit on we are seeing fewer people in the emerge, but also when it comes to the care clinics. I heard you say 500 people at the 2 care clinics, but it seems to me, I remember you were expecting something like 200 a day each. I wondered if you could speak to why, again, that might be that they're not quite at the capacity you thought they might see.
So that was sort of the maximum number of patients that we'd expect at the clinics. So we certainly can ramp up activities. Those clinics are quite specific to people with febrile respiratory illness. Again, with the folks presenting, we're able to meet the demands on the clinics, and we do expect that number to rise. It's an open access clinic where folks will self-present, and we will continue to message that if people are experiencing fever and respiratory symptoms, then and they feel they require a medical assessment, to present to these clinics for care. And again, the number may increase, and we will upstaff as necessary to accommodate that load.
And my other question had to do with the SWAT teams that the province has announced, and it sounded as though, some hospitals have already worked with long-term care homes in the province, even in the last 24 hours. Could you tell us more about whether that's happened here, how quickly that would happen, how you would prioritize which homes to go to?
Absolutely. So the strike teams that we've created are going to couple with our community paramedicine initiatives. So we have community paramedicines who are already going to long-term care to swab patients as necessary to prevent the need for transfer to hospital if they do not require hospital-level care. To these paramedics, we're going to be coupling our family physician outreach model from our regional labor pool of family physicians to be able to provide additional swabbing capacity, as well as to be able to provide primary care to these patients. We are also working closely with public health to add infection prevention and control specialists, as well as public health specialists to go into facilities requiring support. And that model is something we're going to have completely operational in a very short period of time. And I'll be able to provide more details on that shortly.
Right, but it hasn't happened yet. You're not one of the hospitals in the province that's done that already?
We're live with the community paramedics, and in a matter of days, we're going to have our strike teams fully operational. So it's really in the final planning stages, and it'll be ready to roll out very soon.
I might just add that the Ottawa Public Health staff, that are public health nurses and public health inspectors, have already for weeks and as part of their usual work year-round been working with long-term care homes and retirement homes to make sure they understand the guidance and to make sure that they understand the evolving guidance. And so our teams make site visits regularly. If there's an outbreak, that's part of what we do. And we also will make site visits if people have questions or concerns. If there's something that's flagged, they need us to support them and investigate.
Thanks.
Great, thank you, Kate. 1310, please proceed.
Hi there. I believe Dr. Wilmore might be best suited to answer this question. I'm wondering, as we're asked to physically distance, which could potentially go on for quite some time, are you expecting a sort of extended mental health cost or increased mental health demand on the healthcare systems as a side effect of physical distancing? And I'm wondering if there's any sort of medium or longer term planning ongoing at this point to try to help respond to that.
Certainly from a clinical lens, emergency department occupancies are currently quite low. So as Dr. Etches mentioned earlier, I think it's important for folks in crisis to reach out to the resources that public health has made available on their website. And for folks that are unable to manage at home and require acute mental health support while in crisis, the emergency department is a good place to go. In terms of what the impact is going to be moving forward, I don't want to speculate, but certainly it's something that we're taking very seriously. And with our public health colleagues, trying to message that, outreach models for from a mental health perspective, using online tools, the socializing with loved ones, and the use of the emergency department are all options.
Thank you. My follow-up is for Dr. Etches, and I'm wondering if, as physical distancing works and keeps cases of COVID-19 to sort of a manageable level, there's a risk of having people looking at that and saying, well, look how few cases we have, we should end the restrictions. But you have the lower number of cases because the physical distancing is working. So I'm wondering if Ottawa Public Health is doing any sort of planning or has any ideas how you can inform and educate people and basically prevent physical distancing sort of becoming a victim of its own success.
Yes, well, you're part of that. So let me tell you why everybody was so motivated to do physical distancing. It was because we saw what COVID-19 can do to a community and do to a healthcare system. And when we looked at other countries, and we saw that a healthcare system could be so strained that they would have to choose between who lives and who dies, and they would not be able to handle routine things like a heart attack that came in. So that's what we all were concerned about. We're concerned about our loved ones, about people being ill and possibly dying. And so those risks are still there if the amount of infection in our community grows. And so we need to have in place strong assurances that we can handle that, that our hospitals are ready, that they have all the personal protective gloves, gowns, masks that they need, that they have the surge capacity of beds that they need. And that's very good planning underway. So they're making great progress, but we're not there yet. We also know that we need to be able to have a strong surveillance system and testing and case and contact management to follow up on the cases that arise so that we can attack those small clusters, those groups, and contain the disease in a more targeted way. We know that it is important as soon as we can safely do it to start to ease up on the restrictions because it's been hard on people. And so these are the things we want to have in place. And then we need to work together. It's a whole community effort, just like it has been so far. Everyone's been doing their part. We need to communicate that we all are going to have a part to play in relaxing the restrictions safely. And so looking at ways people can understand and buy into that, continue to do their part, feel empowered and safe to go out, if that's going to be wearing a mask, if that's going to be maintaining working from home or, finding ways to do physical distancing in different workplaces and that we haven't done that before. These are things that we want to continue to have a dialogue with the community about. As I said, I think it's important to hear what the barriers are, what the ideas are from people as we go forward.
I could add to Dr. Etch's comment, the public health measures that the community is taking to flatten the curve are the only reason that we have lead time to be able to do the builds that we're doing in order to accommodate surge. So while we're in the build phase, it's very critical that we maintain these precautions because, again, we have to have the system in place to be able to tolerate a large load of patients and not disrupt the delivery of care in other sectors. So I just wanted to echo that. It's a really big deal, and we need the public to do its part.
Thank you.
Thank you, Jason. Le prochain, Olivier, avec 104.7. Outaouais.
Ma question est similaire à mon collègue anglophone juste avant moi. À la lumière des chiffres plutôt encourageants au niveau de l'hospitalisation, est-ce qu'on prévoit un déconfinement bientôt à Ottawa et à quoi va ressembler ce déconfinement à Ottawa?
C'est pas juste ma décision. Nous ne sommes pas prêts maintenant. Notre système de la santé ne sont prêts. Il y a beaucoup de questions concernant la méthode d'avoir sécurité avec un changement dans la distanciation physique ou la diminution dans les restrictions. C'est une question pour tous les niveaux de le gouvernement fédéral, provincial et aussi local. Alors, c'est bon de commencer avec un dialogue avec la communauté, de comprendre leurs questions, leurs besoins, leurs priorités aussi. Mais comme Dr. Wilmore a dit, nous n'avons pas un système de santé des hôpitaux prêts. Nous avons des éclosions dans les populations vulnérables encore. C'est trop tôt de discuter la fin de la distanciation physique. On a besoin d'aller lentement.
Et mon follow-up, c'est qu'est-ce qui vous inquiète le plus que la période d'isolement se poursuit? Est-ce que vous êtes inquiet pour la santé mentale des résidents d'Ottawa?
Oui, la santé mentale, c'est vraiment un concern pour nous, Santé publique Ottawa. C'est aussi pour moi, c'est une question de l'impact sur l'économie, les emplois, la situation pour les familles qui moins de ressources. C'est vraiment un défi et je voudrais recommander que la population avec des stress financiers aille à le site web de la ville de trouver soutien.
Merci, Olivier. That's all the time we have for today. C'est tout le temps dont nous disposons aujourd'hui. Thank you all for joining us. Merci à vous.